Good morning, students. Today we will see about glycogen storage disease. So already we have seen glycogen metabolism. So both glycogen breakdown as well as glycogen synthesis. So when you take extra carbohydrate, whatever the glucose we have excess, that will be stored in the form of glycogen. When we are under starvation or when we are under low carbohydrate diet, the stored glycogen will be cleaved and that glucose will be utilized. So in case any defect in this metabolism of both the breakdown or the synthesis of glycogen, it leads to glycogen storage diseases. So these are glycogen storage diseases are the group of inherited disorders associated with glycogen metabolism. It may be familial incidents or characterized by deposition of normal or abnormal type or quantity of glycogen in the tissues. So we have different types of glycogen storage disease. One by one, we will study in this half. Type 1, von Wieker's disease, the enzyme deficiency is glucose 6 phosphatase. So the enzyme is absent in the liver and also in the intestinal mucosa. The inheritance is autosomal recessive. Liver cells, intestinal mucosa, and cells of renal tubular epithelium are loaded with glycogen, which is normal in structure but metabolically not available because of absence of glucose 6 phosphatase enzyme. So the clinical and biochemical features are very little glucose is derived from the liver. The children with this disease tend to develop hypoglycemia so easily and often. Glucose 1 phosphate cannot be converted to glucose 6 phosphate due to deficiency of enzyme, and it is locked in the cell. Fat is utilized as energy stored instead, which leads to lipidemia, acidemia, and ketosis. Excess acetyl-CoA is diverted for cholesterol synthesis, resulting to increase in cholesterol level, which also produce xanthomas. Increased fatty acid synthesis can produce fatty infiltration of liver. Persistent hypoglycemia can have two effects. Hypoglycemia inhibits insulin or decreased insulin secretion, which in turn inhibits protein synthesis, which causes stunted growth or dwarfism. Hypoglycemia stimulates secretion of catecholamines, which cause muscle glycogen to break down, producing lactic acid and lactic acidosis. Increased blood lactic acid competes with urate excretion by kidneys, leading to increased blood uric acid level. Prognosis: although many of these children die young, a number of them have survived for adolescence, when for some unknown reason, much improvement can occur. Type 2 disease or type 2 glycogen storage disease is also called as Combs disease. The enzyme deficit is acid maltase. The enzyme is present in lysosome and catalyzed breakdown of oligosaccharides. The way of inheritance is autosomal recessive in nature. The clinical and biochemical features, which include glycogen structure, which is normal, generalized involvement of organs, seen including heart, liver, smooth and striated muscles, nearly all tissues containing excessive amount of normal glycogen. Clinically, enlargement of heart, cardiomegaly is seen, muscle hypotonia leading to muscle weakness. No hypoglycemia is seen in this condition. Prognosis: infants usually die of cardiac failure and bronchopneumonia. Death usually occurs before 9 months. A few cases, milder form, survived up to 2.5 years. Type 3, limit dextrinosis or Forbes disease. The enzyme deficit is debranching enzyme, inheritance, autosomal recessive in trait. Clinical and biochemical features includes glycogen structure, which will be limit dextrin type, abnormal, short or missing outer chain. Organs involved are liver, heart, and muscle cells. Hepatomegaly, moderate hypoglycemia, acidosis, progressive myopathy are all involved. Similar to type 1, but glycogen is abnormal and runs in milder course. The enzyme deficiency can be demonstrated in leukocytes. This is used as diagnosis for the diagnosis of the particular type. Prognosis: survives well to adult life. Type 4 amylopectinosis or Anderson's disease, enzyme deficiency, which includes branching enzyme. There are no defined inheritance seen. The clinical and biochemical features, which include glycogen deposited in abnormal type, few branch points, and very long inner and outer unbranched chains, which look similar to amylopectin. The main organs affected are liver, and other are heart, muscle, and kidney. Deposit occurs in rough endoplasmic system. Hepatomegaly, splenomegaly, ascites, and moderate hypoglycemia, nodular cirrhosis of liver, and hepatic failure. Enzyme deficiency can be demonstrated in leukocyte as well as liver. The prognosis, which is usually fatal, longest survival reported as 4 years. Type 5, McArdle's disease. Enzyme deficit is muscle phosphorylase, and the pattern of inheritance is autosomal recessive. The clinical and biochemical features, which includes the glycogen deposition in normal structure, and the organs involved is skeletal muscle, where excess of normal glycogen is seen. Muscle cramps on exercise, pain, weakness, and stiffness of muscle is also seen. No lactate formation. Muscle recovers on rest due to utilization of fatty acid for energy. Epinephrine test. After administration of epinephrine or glucagon, raise in blood glucose occurs, which shows that hepatic phosphorylase activity is normal. Type 6, Her's disease. Enzyme deficiency, which includes liver phosphorylase. The clinical and biochemical features, which includes glycogen deposited, is normal in structure. Organs affected are mainly liver and also leukocytes. Hepatomegaly, mild to moderate hypoglycemia, mild acidosis, presents like mild case of type 1. The condition also has been reported to occur in association with Fanconi syndrome. Lewis et al. 1963 described type 9. The enzyme deficit is including glycogen synthase. Organs involved will be liver, erythrocytes. Liver glycogen is reduced much, very low. Clinical and biochemical features include hepatomegaly due to fatty infiltration and hypoglycemia, especially seen during fasting. Thomson et al. Disease, where enzyme deficiency is phosphoglucomutase, glycogen deposited is normal type, organs affected are liver, muscle. Clinically, moderate weakness of muscle, wasting of skeletal muscle are also seen. Torres et al. Described type 7, enzyme deficit is phosphofructokinase, organs which involved is principally muscle. Moderate accumulation of glycogen is seen in muscles, especially the skeletal muscle. Also, there is a marked accumulation of glucose 6-phosphate and fructose 6-phosphate, and marked diminution of fructose 1,6-bisphosphate. Clinical manifestations which are similar to type 5, McArdle's disease. Type 8, enzyme deficiency is hepatic phosphorylase kinase, failure of hepatic glycogen phosphorylase activity leading to decrease in glycogenolysis. Clinically, hepatomegaly, raise in liver glycogen level of normal structure, mild to moderate hypoglycemia occurs. This is all about glycogen storage disease. We'll see some of the disease in the next class. Thank you.